happiness is the sun being out.
Mhm.
And we still, and it's good morning.
Oh, that was good.
Yeah, the sun is out. So it is April 17th. This is Senate Health and Welfare today. We're looking at H72, and then we're moving on to some other bills. Trying to get to some final markup and vote, and an H72 is one that we've worked on quite a bit. So hopefully we can look at the draft that Ledge Council is bringing us, Michelle's brought us, and go through the bill with an eye to finalizing the language. So there you are.
Good morning. So I'm going to share my screen. So we're working off of draft, so for the record, Michelle Child's Office of Legislative Counsel, and we're looking at draft 2.1 of your committee strike all to H72. And now we have an hour, but boy, that hour goes by really quickly. So I am just gonna go over the highlighted sections first, and then if you want to go back
Yes.
through, does that make sense?
Yep, that's helpful.
Okay, so the changes that are in here are some just minor tweaks to language based on what you had discussed at the last committee meeting. And I just, as I'm saying that, I realize there's actually one thing that isn't in here, but I think that that's if there's some policy stuff in there that I need some direction on from y'all as well. And then Senator Hardy had provided some suggested changes, and so I'm just gonna go through and hit the highlighted. So you'll see in section 1, remember we're working in this new statutory section in chapter 84, talking about what are overdose prevention centers, what services do they provide. It directs the Department of Health to establish guidelines that build on the requirements that you've placed in statute. And you'll see here in subsection A in subdivision 1, it says that it provides a space, something that was in the House proposal, and had been in there when there were 2. And then when I went to 1, I think just in my head, I was thinking of it as a fixed location, but that's not necessarily the case. And so that was pointed out to me. So I just returned the language to what was in there before so that it's either at a fixed location or a mobile facility.
That's good.
Just a technical change on line 19. So one of the things that the chair had asked be included in the last version is providing drug checking services. I think I called it drug testing services in the last, but that's not the correct term. So that's just changing to drug checking services. And I couldn't recall about whether or not, and I can change this for you, but to recall on the adoption of the guidelines. Did you had talked about September 15th, or was there, because I had initially just put as a placeholder.
Oh, that's it. I mean, I'm open to that. We can say August 15th. The question is, not later than, and August 15th is pretty, and this happens on passage.
Yes.
Well, there's really time for that to happen. Isn't there?
I just put it in as a placeholder, but because
Yeah.
you have to have the guidelines prior to the city being able to develop a grant proposal.
That's true.
And so there's time, so it's just really about how you envision how quickly things will move along, but.
Right. Let's just leave it. Unless someone would like to make a change, we could move it till September 1st, September 15th. It's all like adding 30 days for the work to be done.
I guess I would probably, Department of Health is not here in the room. I know that DSU is fairly overloaded, so I guess I would say giving them a little bit more time would probably be appreciated.
That's what I had suggested last time, so let's do that. Let's put September 15th in.
Okay. Yeah, and I think especially given that summer and everything, so.
What about even later than that,
October 15th?
like till the end of the year in December?
No.
I think we want to
It's
make
the
sure that they have to have
guidelines.
the guidelines before the city can even apply. So I think making sure it's done in the fall.
I wouldn't go any later than October.
Yeah, I think September, and given that there are guidelines available for them to sort of crib,
Okay.
whatever, I think they can do it. I just thought in the middle of the summer is kind of harsh.
Yes. Yes.
Okay.
Right.
September.
September 15th?
Yeah.
All right.
The House could always send us a proposal amendment. Pending.
So on the issue of the operating guidelines and the level of staff qualifications. So there was the first part of the sentence came over as part of the House proposal. And the second part was something that was recommended by the mayor in consultation with Burlington Fire Department. But we talked a little bit last week about concern that when they're developing the guidelines, that it not be so restrictive that everybody has to be licensed and things like that. And then I think David Mickenberg had sent you some language about looking at like what Rhode Island has, and I can, once we go through this draft, I could pull that up, but it's kind of it's a policy decision for you that about what if anything you want to change in here or add to. What I did do is I left the existing language there and then I just added this sentence that you'll see at the top of page 3. And I think it still works with what's there without changing anything else that's already before that, but again, up to you. So personnel staffing centers, personnel staffing centers, right?
Yeah, that doesn't make sense.
Personnel staffing may include.
Right.
It's
gone through everything,
Personnel,
but we don't catch everything.
Personnel staffing centers. may
Personnel staffing
include-
centers, right.
Personnel staffing centers?
I know, I get it, but I stumbled over it and I wrote it, so
Oh,
it's okay.
personnel.
Yeah,
Staffing center.
personnel.
I get
You are
it.
right.
English is so easy.
Next version, I'll see if I just wanna tweak that, but apparently, I wrote it and I thought it made sense when I wrote it, and then the editors didn't change it, so.
Basically, folks who work there
Right,
might.
exactly, may include,
Would there have to be comma after personnel and centers?
I'll rework that a little.
Yeah,
make it
okay,
look
well,
better.
we
But it's not required to include peers, case managers, medical professionals, and mental health counselors. And so that's kind of like what they have in Rhode Island there. So, but I feel like this isn't, something I just want to draw your attention to because of, I think there's been a lot of input from various witnesses on this particular area. And I want to make sure that I'm getting clear direction from you about what you'd like. So subsection C, with regard to the needing of an affirmative vote from the municipality, that is struck. And you'll see when we get down to the grant language, it does require that the grant proposal that is submitted to the Department of Health for the funding has the approval of the city council. Yeah.
That is there on page 5. Got it.
Just added a little belts and suspenders at one of the witnesses' recommendations on the immunity section when it's talking about how the immunity provisions apply. And there's some language there that I think had been recommended earlier around entering or exiting a center isn't the basis for getting a warrant, search and seizure, property, things like that. And this just utilizing the services, I think that's already encompassed in there, but fine, it doesn't hurt to have that in there. Moving on to section 2. And this is your appropriation for the pilot program. And you'll see the language that I just spoke about on line 17 and 18. So upon submission of a grant proposal that's been approved by Burlington City Council that meets the requirements of section 1 that we just went through, as well as the department guidelines.
Question.
Yeah, just kind of wondering out loud if, the state gave Burlington permission to do this. Why couldn't Burlington pay for it themselves? Just a thought.
It's a lot of money and
That's what.
they don't have as much, they don't have many resources, and we have the opioid fund that is for this purpose, that's to use for this kind of program.
Okay, thank you.
So the next changes, moving on to surrender service programs and the appropriation. So you'll recall that the language that was in the prior amendment was just picking up the language that's currently contained in the budget. And that was on line 7, that was $1 million from the opioid settlement fund, and that has been increased to $2 million. And then you'll see the new language that's highlighted on lines 11 and 12. So the method of how the funds are going to be distributed is to be by mutual agreement of the Department of Health, the current approved syringe service providers, and other relevant community overdose prevention and harm reduction service providers. And then that language after was also something that you added in the last sentence.
Okay, Senator.
Funding, so Nolan and I talked yesterday. So trying to keep both of the funds in balance, because we're moving the money from the
Opioid settlement or the
no,
evidence
from the
based.
evidence base, that fund is fine, this.
Yeah.
The opioid settlement fund, once we move the 1.1 million for the site, no, for the site, that, the syringe 1.1 million is already in the opioid settlement
Yes.
fund. So it's just about how much is available to increase the 1.1 million. So what is available is, 350,000. So if we did, so that would mean 1,450,000 instead of 2 million, and that would keep the fund in balance.
And you went through that with Nolan. I'm sorry he's not here.
Yeah, I did. I mean, he and I walked through and that's why I haven't had a chance to just double check with him this morning, but based on the information that we discussed last night or yesterday when I went out and call, and then, the spreadsheets I have, I think that would be, and I will also say that a lot of the things, the fund continues to have money trickle in, and a lot of the things that we committed money to haven't been paid out yet, so there's actually a lot.
It'll be a balance.
But I think that 1,450,000 would work for. And that would leave like a little cushion. He's right here.
So as we were saying, Nolan Langwell is here. Thank you. We're looking at, first, before we check off on the language, are there questions for Michelle on the language that we just went through? So. Senator Hardy.
Yeah, I have one more thing, sorry, Madam Chair, that I meant to mention earlier, but I keep forgetting, so I just remembered again. Which is that I think we should put language in that exempts the OPC from the CON process. Because that became an issue with
You're right.
the little,
Yes, it is.
yeah,
Satellite
the hubs. So we want to put it in here, so it's the certificate of need process through the Green Mountain Care Board. It will just delay things if they have to go through it, so.
Yes.
So that's my suggestion.
I'll check in with Katie about that, but did you do this recently with something else?
Yeah, in fact, I think
thinking
in
I
the
could just look at
BAA,
it. We've done
there was
CON.
actually language in the BAA
Okay.
that exempted the satellite methadone hubs from the CON process. But I think there's standard language that Katie or Jen could just give you to.
Sure, okay.
Yeah.
So the two things that I have that I understand from you at this point for changes in the next draft are changing the date from August 15th to September 15th for having the guidelines done. And then this new provision around exempting VCs from the CON process.
Yes,
And the money. The change in the number.
well, so as soon as we get to Nolan, then we'll talk about, before you go there.
That's what I think we'll keep.
So let's Senator, let Nolan come up and we'll hear from him and then we'll confirm what goes into the bill.
Thanks, Michelle.
But before, Michelle,
Yeah.
there's one question.
Yeah.
Are there other questions of other committee members on the bill? Did you get your question answered regarding liability? Okay. Can we spend 2 minutes talking about liability?
Sure. And is something in particular, I've talked about the criminal liability some, and I've talked about the civil liability, so is there something in particular that I can answer for you? And I'm wondering about, like, was it an issue about, because we talked about, like, in terms of the drug laws, you have the state and federal. State can choose what they would like to do, just like they've done with the campus. There is potential liability at the federal level. We don't know how that's gonna play out.
Yeah, so it's, I'll put it in terms of like, the state, controls, distribution of alcohol.
Right.
Okay, so we sanction bars. Okay, in this case, we're sanctioning a facility.
Right.
Where the product is enormously more powerful than anything that a customer would purchase from a bar. I know the parallel isn't, 100% accurate, but I'm concerned that the state, having sanctioned the center, allowing the citizen to consume substance and then go back out into the general public, creates a certain liability for the state if you follow the decision chain backwards. That's my concern. And again, I'm not a lawyer, so I don't know. how to
So,
address-
you may have heard the term sovereign immunity in different contexts, and that's just, something that goes way back to British law with kings and queens and the idea essentially that the state cannot be sued without its permission. The state has given its permission in some contexts. So you have something called the Tort Claims Liability Act, and it's in Title 12, where it goes through and it says, well, these are the instances, these are the circumstances under which someone can bring a claim against the state. But it has to be, and I'm trying to figure out how to explain this, so it has to be analogous to something that a private person could bring, right? So then you look at the actions of the state, right? What is the state doing in this context? It's establishing guidelines. And it's a pass-through, and it's a pass-through for money. It's passing money on to an entity that is going to regulate it. It's been well established in case law in Vermont with, I think, some DCF cases and DOC cases related to it that, lawsuits against the state where the state's role was like licensing or inspecting, things like that, are barred by the Vermont Tort Claims Act. And so there's really not enough of a nexus between what the state's involvement here and how somebody could be able to bring a claim. So because establishing guidelines and appropriating money is, I would argue, far less than, what you have a lot of what state agencies do all the time, which is licensing facilities, like in the cannabis control world, or talking about, liquor, actually, I think, distributing the liquor itself, And it doesn't apply for things like that for licensing or for when the state is inspecting facilities. There hasn't been found a certain duty that the state has to that person for them to be able to come back and claim that it was negligence on part of the state to be able to stay in police. So I don't have any concerns in that particular area.
Thank you, Michelle.
Okay, any other questions? Anything in the bill?
Looks good.
All right, good, thank you, Michelle, it was really, that helped, I think that helps all of us
Sure.
understand the obligations. Responsibility,
That was an act 20.
so. No,
Well, we haven't had a chance to check in some things.
well, this is time to do it, we'll go through it together. Do we have something that we can put up on screen?
No, because I wasn't anticipating talking.
Okay, well,
Do
we don't know what. We're looking at the money that's.
Right, you don't need the bill on
You
it.
want the bill up with the funding that's currently there?
No.
Okay, and it's really about balancing what we have in the opioid fund with what the bill is asking to do, and one of the suggestions, it has been made that we expand the syringe program to include more parts, geographic areas of the state. But that's the increased need in the bill. Then it also then influences all the other expenditures that are in the opioid fund, and I'm not sure we don't have our arms around what
Yeah.
all is in there at this point.
Okay, for the record, Joel and I were joint fiscal office, don't have a sheet to share because I didn't know I was going to be testifying. Otherwise I could pull something up and show you, but I have given to you perhaps, or some of you.
Yep, we got it.
If we have,
We all have
is
it.
that online maybe?
Kiki, we're looking for this one.
Yes.
It's the opioid abatement fund recommendations. Act 22. It's one
I don't have my
of
link
the
on my
marks on it right here.
Ruth, you know what date?
We can look at this and
No,
then
no, I just have a printout, but it should be under the bill.
Yeah, it could be on the bills or on the middle.
Yeah.
And that's under my name. And if you find it, if you just throw it on the screen.
You want to look at it?
What,
Yeah, I got it. Thanks.
so in short, if you look at the issue, not the issue. If you look at what the House passed, there's 1.47 on the bottom.
let me ask you a question. If we gave you 10 minutes, could you put something together, or is that too little time? We have a half an hour on this bill. If we took a break for 15 minutes, is there something you could do, and you have time to?
I could do something, yes,
All this stuff.
I-
Just pull that up.
I have two things I can pull up and show you.
Okay,
You give me. We go on a 5-minute break.
we're gonna give a 10-minute break. We'll come back at 20